Hello everyone. I'm one of the internal medicine residents who did this project under the guidance of our attending Dr. Jilani. This QI project has been done at our primary care teaching clinic at Einstein Medical Center, Montgomery in East Norriton, Pennsylvania, United States. The name of our QI project is A Community Centered Experience with Diabetes and the Road to Achieving Perfect Diabetes Control. We all know type 2 diabetes affects many people daily. As per American Diabetes Association, it affects about 1.4 million people every year in United States. It can cause so many complications as it is a chronic disease. These complications can be either microvascular or macrovascular, which can include but not limited to coronary artery disease, strokes, neuropathy, retinopathy, and nephropathy. So it is very important to achieve target hemoglobin A1C to avoid these complications. It is also extremely important to investigate the management in patients with well-controlled diabetes. Yes, well-controlled diabetes. So that we can apply this knowledge to our uncontrolled diabetes patients. But we can also see if we can improve the way we are managing the care in patients who are well controlled. So the goal of our QI project is to investigate the diabetic care in patients who have well-controlled diabetes in our primary care teaching clinic. So in order to achieve this, we did a retrospective descriptive analysis of 69 type 2 diabetes patients whose diabetes is well controlled since 2013. Our target hemoglobin A1C is between 7 and 8.5. We chose this range based on age and life expectancy, and these guidelines are from American Diabetes Association. Patients who do not meet our hemoglobin A1C target between 7 and 8.5 were completely excluded from this study. So from the data we collected, we were able to do 4 different graphs. First one on the top left is showing different diabetes strategies that we use. 82% of our patient population are just on oral medications. Only 3% of our patient population are on newer agents like GLP-1 agonists. Some of our patient population, approximately 15% are on insulin. Out of these 15, 4.3% are just on insulin, but 11.5% population are both on oral medications and insulin. Coming to diet and exercise, 52.2% of our patient population was compliant with diet, 37% were compliant with exercise. Most of the control is being achieved by us. 70% of patient population, they follow only us. 27.5%, they are being seen by endocrinology intermittently. Top right one is showing what medications we use. The oral medications that we use is metformin. 93% of our patient population is on metformin. 21.7% of our patients use oral sulfonylureas. 15.9% of our patient population is on SGLT2 inhibitors. 7.2% are on DPP4 inhibitors. 5.7% are on thiazolidinediones. Coming to the bottom graphs, the left one is showing the frequency of visits and right one is showing frequency of blood work, meaning how frequent are they coming to us and how frequent are they getting their blood work done. Most of our patients will see us every 3 to 6 months, almost 70%, and almost 63% get their blood work every 3 to 6 months. As we all know, the ideal and definitive treatment for diabetes is oral medications in combination with lifestyle modifications. Our study has proven this again. 82% of our patients are only on oral medications and they have a perfect diabetes control. Despite our patients not being on newer medications like SGLT2 inhibitors and GLP-1 agonists, we have achieved a perfect control of diabetes with oral medications in conjunction with diet, exercise, and repeated counseling. Any study that we do always shows a chance and opportunity to improve. Our study showed this as well. 3% of our patient population is on GLP-1 agonists while 65% have a BMI of more than 27. 15.9% of our patients are on SGLT2 inhibitors while 32% have CKD. Compliance with diet and exercise is always important but hard to achieve. 52% of our patients are compliant with low carbohydrate diet and 36% are compliant with exercise. The use of new agents and compliance with diet and exercise in our study, the percentages are quite comparable to other studies. However, it definitely suggests an opportunity to improve. Finally, it is very important to investigate the management regimens and treatment strategies in patients who have well-controlled diabetes to see if we can apply this knowledge to achieving perfect control in uncontrolled patients. And it also shows if there is an opportunity to improve the care in well-controlled patients. So these are the references that you can definitely refer to see how comparable is our patients' compliance with diet and exercise with other studies. Also our compliance with SGLT2 inhibitors and GLP-1 agonists with other studies. Thank you.